So the work is not completely done. We are very pleased to announce the first positive randomized clinical trial in basilar artery occlusion. I think this is very important. There are some limitations, was essentially an Asian Chinese cohort. So the generalizability of these findings to the Western population needs to be thought about, but we did a subgroup analysis looking at patients that didn't have any evidence of intracranial atherosclerotic disease. And in the non-intracranial atherosclerotic disease cohort, the benefit was statistically significant. So I think we have good evidence to kind of translate these findings to other populations based on that. In parallel, there was another Chinese trial that's going to be presented here at the conference tomorrow called the BAOCHE trial. We investigate the earlier window, 0 to 12 hours. The BAOCHE investigator concentrated in the 6 to 24-hour window. In that window, there is even less usage of intravenous thrombolytics. In our group, there was about 1 out of 3 patients who received thrombolytics. I suspect, not having seen the results yet, that's going to be lower because most of those patients will be outside the thrombolytic window. So that's going to kind of hopefully complement, and my hope it's going to expand the positive findings to a larger window of opportunity for us to help these patients. The other important development, which we're just starting to evaluate now, is how about if you start using intravenous thrombolytics, specifically TNK or tachnetapplase, to patients that come to us with a basilar artery occlusion, even if it's beyond 4.5 hours. And there is a trial that just started in Australia, but it's expanding to many other countries called Post-Eternal, that is trying to answer the question. Will pre-treatment intravenous TNK improve the outcomes of basilar artery occlusions up to 24 hours?